This is Dr. Prasad, oral cancer specialist, KIMS Hospital. Today, it's a very important day because the WHO organization has made this day as a no tobacco day. Tobacco, why we are all talking about the tobacco? Because this is the most dangerous habit nowadays throughout the world, and it's a burning problem. You can see the statistics in the world. Every year, more than 6 million deaths are occurring due to tobacco smoking. Apart from that, the passive smoking is a more dangerous one because some people is going for a tobacco habit, and because of those people, the neighboring people who are working in their offices as well as they are suffering. That is called as a passive smoking. Apart from the smoking and a passive smoking, there is a chewing tobacco related products. They are more carcinogens. Why we are more talking this one on this day? Because this year there is a special theme came from the World Health Organization regarding this day. What is the theme? The theme is stop promoting, stop advertising, and stop sponsoring. These three we have to do for this year to get a best result out of that. Because from past 1987 we started this day to satiate the tobacco products. But still, after 20 years also, nothing we have reached. We have reached many minimal goals. Throughout the world, only 6% of the world is free of tobacco. But now, why? The major problem of tobacco, how we will consume the tobacco? By taking off the mouth. Smoking, how we will smoke? Through the mouth. Chewing, how we will do? Through the mouth. Everything we are doing with the mouth, and the mouth is the gateway of all the health to the body. How we are spoiling? By taking this tobacco, we are getting the very difficult, non-curable disease of oral cancers. Oral cancers, everyone now is talking about the oral cancers because it's a very different task of the disease, and there is no survival rate for this disease. How the oral cancer occur? Not only the oral cancer, the precancerous conditions. Tobacco leads, the first drawback in the oral health is the one staining. You can see a lot of people with stains, they are having the habitual tobacco. The stains cause aesthetic. And the second thing is halitosis. Halitosis is the bad breath. How we are getting the bad breath? Only because of the tobacco. Why all these things are happening? When you are having your cigar, the carcinogens which are there in the cigar, more than 28 to 30 carcinogens, they are affecting the oral cavity. In oral cavity, what are all the main things how we will observe in the oral cavity? The first thing is the more decay. Second thing is the gingival problem. You know, very specific, the gingiva detaches from the teeth, and the surrounding of the teeth is called a periodontium. More of the people will suffer with the loss of teeth, early loss of teeth. And in any treatments, implants, treatment and all that is a failure of that one. And the third thing is the salivary content. Saliva is most important because it cleanses our oral cavity. If the saliva drops, there is no function of cleansing. When there is no function of cleansing, automatically what are the things you are consuming per day, 3 or 4 times, will struck in that area, it causes further decay. And the third one is reverse smoking. You can see in our state itself, in Srikakulam especially, the females, they will take reverse smoking. The reverse smoking will cause hazardous for the palate. This is called as a smoker's palate. It is very dark in color, and papillomas will occur in that area. And the third one is thrush, candidiasis. Candidiasis will occur most of the people because of the lack of the saliva and the pH. And what is the main drawback of this one is the early loss of teeth and precancerous lesion like the lichen planus and submucous fibrosis. What is the submucous fibrosis? You can see nowadays everyone is having just pawn parox and all that. It's a habitual of the teenagers they are having, and most of the time is auto rickshaws, these lorry drivers and all that. What is the main complaint? They will come after a few days after having the tobacco complaining of, sir, we are not able to open our mouth. We are not consuming the spicy products. Why you are not consuming the spicy products? Because that is a precancerous condition. If you left that condition untreatable, it will become a more dangerous cancer. And submucous fibrosis is nothing but the rubbery stage of the cheeks. You can't able to open. The patients straight away they will come and they will ask, sir, we can't able to open the mouth. We are not able to feeding also. What is the thing main is the tobacco chewing habit. It's not because of smoking, it's a chewing habit. Not only the oral, from the oral it enters into the throat, from the gastrointestinal tract, and everywhere the cancer. More cancer is the lung cancer of inhalation, and in chewing gastrointestinal cancer and liver cancer, and lot of cancers will come. So what is the main aim of today is quit tobacco before it kills you. We have to quit. If you are a habitual of tobacco, you can quit immediately. If you are not a habitual of tobacco, you can promote, you can educate your neighboring not to have the tobacco. We want the tobacco as a free tobacco world. Our aim is free tobacco world. We are going to achieve. Definitely every individual have a responsibility to participate in the no tobacco day, and at least you can terminate a 1% habit. We will reach the goal as early as possible. No tobacco day. Jai Hind.